as always with our State of series, our State of Healthcare, it is being taped by Vincennes PBS, just so you guys know that before we get started, but okay. My name's Jamie Neal, President of the Knox County Chamber of Commerce, and I want to thank all of you for coming today to our State of Healthcare series. This series, as we talked about in the past, is, we address certain issues every quarter: state of workforce, healthcare, education, and state of government. So today, our series presenting sponsor is Vincennes PBS, and our program sponsor is Good Samaritan, as well as the gold sponsor is Guardian Angel Home Health Care, with our supporting sponsors of Family Health Center, Good Samaritan Foundation, as well as Guardian Angel Personal Services. Today's focus, we're going to talk about the economic impact of hospitals and some policy updates, as well as some updates with our Good Samaritan Hospital. But as we kick off our program today, we're going to invite Adam Thacker, President of Good Samaritan, to come up.
Thank you, Jamie. Can you hear me? Okay. Good afternoon, everyone. Before we get started, and I'm sure he's getting sick of this, I want to take just a moment to recognize our CEO, Rob McClinn. Will be retiring at the end of the year, and thank him for 30 plus years of leadership of the organization. I certainly wouldn't be standing here today if it weren't for Rob's mentorship over the last 12 years at Good Samaritan, and he's put us on a trajectory to be successful and continue to contribute to this community in a way that's very fruitful as an employer as well as a provider. So thank you, Rob. And he's probably sitting there thinking, I am retiring at the right time, because we were talking about the state of healthcare. So a little bit, and I'm sorry, I move around a little bit. A little bit about Good Samaritan. So 117 years, Good Samaritan has been the provider here in Knox County. We service a much broader area than Knox County. This is going to test me as to whether I know my slides or not, so I'm trying to look at you guys and talk. 158 bed, we're a level 3 trauma center, take care of 10 counties, have about 1,800 caregivers strong that wear the Good Samaritan badge, take care of you, your families, the community on a daily basis. Our mission, provide excellent health care by promoting wellness, education, and healing through trusting relationships. We really focus on trusting relationships, whether that is our team and a trusting relationship with the patients, families that we're caring for, whether that is one another between the 60 plus departments and cost centers that make up Good Samaritan across so many different positions. Our vision, the Regional Center of Excellence in Healthcare, and then you can see our pride values, always putting the patient first as we do our work every day. This is our service area. Certainly at the center of that is Knox County. We reach into Illinois and the counties surrounding, and Indiana surrounding Knox County. About 250,000 in population that we care for as the regional center. There's a number of little Good Samaritan beacons that you see here. That's where we have our physical presence and are providing services, and then certainly we draw from this area for services, our centers of excellence, surgery, orthopedics, women's care. We are oncology center as well, so we see a lot of patients that we're able to provide care close to home. Without a Good Samaritan, without a regional center, you're looking at patients traveling hour and a half, 2 hours for high-level complex care that they would not be able to receive. Who we are and what we do, I mentioned 1,700 caregivers. We also have 100 providers, physicians, nurse practitioners, physician assistants, CRNAs, etc. And then not to be missed, 100 volunteers. So many of you, as you come in our front doors looking for where to go, they're helping with wayfinding. They are helping grab wheelchairs, gift shop, all the things. Our volunteers really do make an impact. And then, as I'll talk a little bit more in a moment, as looking at how do we grow, how do we sustain a pipeline of being able to recruit talent. We now have 60 residents across the internal medicine program and psychiatry program. And then I won't read the numbers to you on the left side, but over 500,000 visits coming through Good Samaritan in various different ways. Obviously, a lion's share of that is a lot of outpatient interaction, but that's a ton of churn that is going through the doors every day. So we look at the care, not just the hospital. A lot of times think about Good Samaritan Hospital, 520 South 7th Street, but we are looking at the care that starts pre-hospital. That's our EMS, Emergency Medical Services. We're looking at the acute hospital stay. Certainly, I mentioned level 3 trauma center. We're also a primary stroke center. And that allows us to provide care to patients that have had a stroke at Good Samaritan, provide therapies that otherwise, if we were not accredited, would not be able to provide. And time, many of you have probably heard the time is muscle in a heart attack. The same when there is a stroke, the faster we respond, the better chance that somebody is going to make a full recovery. And a lot of that is geography. If we weren't a primary stroke center, you're going to be outside of that window for certain therapies automatically. I mentioned the centers of excellence. Our ambulatory care, primary care, specialty care, those are our physician offices. Community paramedicine, we're going out to homes, trying to meet patients where they are and address whether it's transportation needs, whether it is cost, whether it is simply fear of coming to the hospital and going to a doctor's office or one of our outpatient services. And then post-acute care, care doesn't stop after a hospitalization, being able to provide outpatient services and really that whole longitudinal approach to the care continuum for patients. Community benefit, so you can see $2.5 million in free medical care in 2024. That's a pretty consistent number. We're going to be right around that again. You may have taken advantage of some of the free screenings, the men's fair, women's fair that we run. You can see hundreds of individuals able to come through there. Also stroke screening, stop the bleed for our trauma, get fit challenges, really just a focus on how do we create a healthier Knox County, a healthier region in providing that type of care, from eliminating some of the barriers with cost and also early identification of things that may be going on that we can get treated before it becomes you need the acute hospitalization. Some major initiatives here, innovative services. If you walk in front of the light, you can't see anything, sorry. Innovative services, so we are investing in technology. Renovated our surgery department. That was a $12 million endeavor. Probably the most impressive aspect of it was we did not decrease surgery and we did not stop surgery at any point during that endeavor. It was pretty amazing to see the engineers come up with a phased approach, and I'll be honest, even more amazing to see our physicians agree to it. Da Vinci robotic surgery, general surgery, urology, GYN surgeries, and this is one of our GYN physicians showing the demo of Da Vinci, where he's driving the console. We now have ion robotic bronchoscopy, so earlier identification of being able to test lung nodules. It's all about catching lung cancer earlier, having a different prognosis when we catch it months, years earlier. FibroScan for patients with liver disease. Now we're able to do a non-invasive scan of patients to identify liver disease early. We just rolled this out a few months ago. I'll be honest, I was walking through Beer House building and the technician that's trained in that said, hey, I need to do 50 test patients, come with me. So I've had that done. My score, I'm good. CIE, our education department, utilizing READY grants, ARPA grant funding, and putting those into action with simulation lab, immersion room, not only training our 1,700 plus caregivers, but we engage a lot with Vincennes University. We engage a lot with our medical students, nursing students coming from across the region to be able to train in a way that simulates what's going on in certain patient environments so that when that really does happen, we jump to action and are able to have the best outcome. We recently opened, April of '24, specialty pharmacy, so now specialty medications that were coming from Arizona, Florida. There were delays in care because those are having to be shipped here. A lot of that is now moved to our 5th and Du Bois. Is that where it's at? Yep. So from Arizona and Florida to 5th and Du Bois specialty pharmacy, patients are able to go to our infusion center sooner and to start their treatment sooner and able to have a local access to those pharmacists. This picture is the ribbon cutting from our 3-bay ambulance garage that is just kind of catty corner from the Heady Education Center that we were able to put up supporting our EMS, be able to keep those trucks inside, decrease kind of the run time, wear and tear. Addressing health equity, I mentioned transportation. Key thing that we've done with transportation, we partner with Van Gogh. We've been able to work with Van Gogh, provide some financial support. They've extended their hours. That's been a big benefit to us. Our patients are getting to their appointments, are getting home and discharge now when they weren't before, and we've seen a lot of benefit from that. That's improving access to care because they're not missing appointments. Workforce solutions, raising the starting wage, $15 an hour. A few years ago, we made that commitment and raised our starting wage. Training program collaborations. A lot of that started with the residency that's right below it, psych, internal medicine, thinking about how do we train our pipeline of doctors. I will say that endeavor as a learning organization, as a training organization, has really blossomed to now we have Healthcare Academy. Now we have 7th and 8th graders coming in the summer to do training with certain areas, and we're starting to recruit them as doctors too, because that's kind of where the recruitment starts. So if you have middle schoolers that want to be a doctor, make sure they're on my list. Affordability of care, Good Samaritan Direct Health, that is our insurance product that we started a couple of years ago in partnership with SIHO as the insurance provider. Just trying to have a local option for small employers to look at how do I provide insurance to my team as an alternative to maybe the marketplace. After January 31st, some of those credits may go away. Good Samaritan Direct Health, good thing to look at. Embracing digital health. This is something that, gosh, the team probably hears me talk about every day and they get sick of me mentioning AI, but we are looking at how do we leverage AI, and that could easily move that up to here. I mean, we're looking at it as a workforce solution too, and not a replacement. You start talking about AI with a group of 1,700 and they think, how are you taking my job away? AI is a assistive, strategic enabler for our staff. We have virtual nursing. We have AI within our Epic EMR system that's identifying patient trends to be able to tell our staff how to act sooner to take better care of them. By the end of the year, we will have every one of our outpatient providers on ambient listening, meaning when they come into the room and are talking to you, that their phone will be sitting there and it is listening and it is documenting everything in the EMR for them. We started that in March, and by April, the first provider, Dr. Stein, who went live, told me I'm never practicing without it again. And it is just, there are very few things, probably in your world as well as in healthcare, that are as delivered or better. There's usually a give and take. This is one of those things that we rolled out, and it is every bit what we've expected and better. And not only for patients is it better, because now I'm just talking to you about your care. I'm not worried about punching keys on the keyboard and figuring that out. But it is also now for our providers that we're spending hours after the day trying to put in all of their notes. They are done at the end of the day. It's a huge bonus. That is going to be coming to nursing. That is going to be coming to other providers where ambient listening is really sophisticated and making a big difference. And then lastly, you're probably ready for me to be done talking. Awards and recognitions. So we don't do anything at Good Samaritan for just, hey, can we get a plaque and can we get an award? But it's great validation that, are we doing the right things? Are we on the right track? So this year we were recognized by Newsweek as one of the greatest places to work in healthcare. Forbes, Best in-State Employer in Indiana. Those are based off of feedback from our employees. I didn't even know about it. I told our marketing director, I said, if I would have known, I would have filled out the survey 100 times. But I promise you, I didn't even know it was a thing, or I would have. But next year, maybe. Inspire Hospital Distinction. So Inspire is our Indiana Hospital Association, looks at hospitals, gives awards based off of excellence. Get with the guidelines. Won't explain all of those, but stroke, cardiac care means we are providing the highest level evidence-based medicine care that you can expect without going to St. Louis, Indy, wherever. That same care is delivered right here. And then I will call out that in '24 we had our magnet redesignation, which is a sign of nursing excellence. And so that is every 3 years? Every 3 years. So that's why you don't see it in '25, because we did so well. You won't see it for a couple more years that we're redesignated. All right, that's all for the Good Sam update. Any questions for me before we move on to Laura? Okay, I would like to introduce Laura Brown. She is in-house counsel for Indiana Hospital Association that I mentioned, and she is now going to take over, talk about everything going on legislatively across the state and how that impacts here at this region as well.
Well, good morning, everyone. It's so great to be with you here today. Just an honor to be in Vincennes, and on behalf of the Hospital Association, we represent 170 members across the state, 170 hospitals. We love them all equally, but Good Samaritan is one of my favorites, and so it's an honor to be here and talk with you all. There's a lot in my slides today because there is a lot going on in healthcare, both at the state level, at the national level. So please don't feel like you have to absorb everything, but it's really just to show you that there's a lot of change going on in healthcare. There's a lot of good things, but there's a lot of things that are really concerning when it comes to state and federal policies and how they might impact our Indiana hospitals. So just want to share that with you and to let you know that Good Samaritan is absorbing and trying to understand what these policies will do to them and their patients and how they can adjust accordingly to continue to provide high quality access to care. So like I said, the Indiana Hospital Association, we represent 170 hospitals across the state. We're the trade association. We work to be a voice of the industry in front of the legislature, in front of Congress, on statewide quality and patient safety initiatives, and we represent all types of hospitals across the state. To provide some context, kind of piggybacking off of what Adam shared with regard to Good Samaritan's economic impact, we have been trying to share with our legislators and also, other community stakeholders about the economic impact of hospitals statewide, and that we really are a driver across the state. You can see some really large numbers up there. In total, a $64 billion impact. We are a major employer in most of our communities across the state, and so anything that impacts us from a policy standpoint could ultimately impact that economic impact. And I won't go over Good Sam's economic impact. You saw that from Adam. But again, we've been trying to hone in with our legislators that strong hospitals also equal strong economies, and that you do need that local hospital to continue to attract employers who want to be able to recruit and retain talent. I also want to touch on the statewide community benefit of hospitals. You heard about Good Samaritan's individual community benefit annually, but we have been talking a lot about the total statewide community benefit of hospitals because there's been a lot of discussion about whether hospitals are earning their nonprofit status, both at the federal and state level. There's been a discussion about whether nonprofit hospitals are doing enough for their communities to earn their tax exemptions. And so we conducted a study late last year, and it showed that in the most recent year of full data, that there was almost $4 billion in total community benefit provided by Indiana hospitals collectively, and almost $2 billion of that was actual free or discounted care. And so in total, Indiana's nonprofit hospitals are providing nearly 2.5 times more in benefit than the tax exemptions they receive. So they far are earning their nonprofit status, but that's data that we've had to share with our legislators as they continue to look at policies related to whether hospitals should retain their nonprofit status. I also wanted to touch on specific numbers related to hospital finances. We've heard a lot from federal and state lawmakers that hospital margins are too high. And maybe some of this, you're like, where are you guys? We haven't been hearing this. But I'll show you a campaign that has been having a lot of impact at the State House in Indianapolis. But this data goes to kind of combat some of those narratives that hospital margins are too high. We've seen some data that hospital margins are 20%, 30%, and I know any hospital CEO in the state would love to have that margin, but that's just not the case. On a cumulative basis in Indiana, you'll see, it doesn't get much higher than 2% on a cumulative basis. You'll have some hospitals below that, some hospitals above that, but we've conducted these studies to ensure that we're using accurate numbers when it comes to make discussions with our policymakers about what the true hospital margins are. And as you can see, we were -2 coming out of COVID in 2022. We've rebounded slightly, but we are still below the national average of 2.6%. I'm gonna keep going. A lot of that hospital margin and what goes into understanding kind of whether you can make a margin within a year comes down to your payer mix. And so I do want to share the statewide payer mix. It's about 60% total Medicare and Medicaid, and I'll show you on the next slide why that number is so essential. And really less than 40% commercial, about 4% self-pay, and I know your guys' number is a little slightly above the statewide average, about 72, or it's much above the statewide average, 72% Medicare, Medicaid at Good Sam. And why that's important is both Medicare and Medicaid do not reimburse hospitals their cost. So every time a Medicare or a Medicaid patient walks in a hospital is losing money on their costs for that patient. And when you have 72% of your patients or 60% statewide coming in on Medicare and Medicaid, that's not covering your cost. And so we've had to be really honest with lawmakers about that. This is, as that payer mix of Medicare and Medicaid continues to creep up, particularly as we have an aging population here in Indiana, it is having an impact on hospital finances. So some of the numbers, Indiana hasn't increased its base Medicaid rates for 34 years. So Indiana has not put more money into its Medicaid rates that it pays hospitals for 34 years. And so today, we get reimbursed about 57 cents on average for the cost of seeing a Medicaid patient. Hospitals across Indiana are committed to providing that access to Medicaid patients, but again, we've had to be honest about what that impact is. Indiana hospitals do fund a supplemental payment, and this is where I get a little too technical, but like I said, Indiana hospitals haven't had a base rate increase in 34 years, so we have taxed ourselves, provided that money to the state, and the state has then used that money to leverage federal funds to increase hospital reimbursement. But that, even with that supplemental payment, that's what gets us to the 57 cents on the dollar. For Medicare, the sum is higher than 82 cents on the dollar, but 82 cents on the dollar is usually about the average for treating a Medicare patient. And a lot of that comes from Medicare Advantage plans denying care that the hospital's already provided, and therefore we don't get reimbursed for it. So again, having those two together below the cost of care does have a significant impact on hospital finances overall. And I also, just kind of rounding out the state of healthcare, we're certainly always focused on our rural hospitals and the health of our rural hospitals to ensure that they can continue to provide that access to their community. When a rural hospital has closed in the past, it has shockwaves throughout the communities, has a lot of impact on the economic viability of the community. So we always try to keep a close pulse on that. Currently in Indiana, we have about a little less than 1/3 of our rural hospitals operating with losses, and about 16% of our rural hospitals are at risk of closure. And so again, we always like to keep a pulse on that because that would have reverberating effects for the whole Indiana hospital ecosystem. So moving on beyond just kind of a state of the union in healthcare, I wanted to share some of today's political climate. And just kind of the difficult conversations that have been coming from the federal and state level, even though we feel like our Indiana hospitals are committed to our patients, committed to quality, and committed to affordability. And I'll go through these slides quickly, but I share them with you because there is a national movement right now related to nonprofit hospitals and nonprofit hospital prices, and painting nonprofit hospitals as a quote-unquote bad guy in the healthcare system. And this really started with a study called RAND that came out in 2017 that said Indiana had the highest hospital prices in the nation. We were immediately, went through the RAND study. We're very concerned with its methodology. It only included 6% of claims. That's not a statistically valid claim sample. But RAND has continued to be released every year and continues to be utilized by lawmakers to point to the fact that Indiana has high hospital prices. We are now 9th in the RAND report after 5 years, but still this continues to have impacts during our policy discussions. Since that RAND report came out, the Indiana legislature has been very hyper-focused on hospital prices. We have been very supportive of transparency and affordability initiatives, improving our statutes related to patients getting good faith estimates related to their medical bills, ensuring surprise bills don't come, et cetera, et cetera. But beyond those transparency and affordability initiatives, there's been a lot of legislation that would have really concerning effects if it was passed. We've had to have a lot of conversations over the past 5 years. I know, Rob, you've been in a lot of those. And a lot of it's been driven by like I said, a national campaign. And it's been sold as a consumer campaign, but there is money coming all across the country to help fund this campaign. This is not your Facebook comment that said, hey, I went to the hospital, my bill was too high, what can I do about it? This is a national campaign that has been funded with various groups and PR firms. And a lot of it's coming from an individual who made his money from Enron. His name's John Arnold. He has a philanthropy organization called Arnold Ventures, and they have been involved in a whole host of things, bail reform, some other items, but hospital prices has been something that he's been particularly focused on. Obviously, you can see the Wall Street Journal covered his efforts on hospital prices. So again, this is not your Facebook group that's complaining about hospital prices. This is a individual who has billions of dollars, who is funding various groups across the country to target high hospital prices. And they have specifically funded a group here in Indiana called Hoosiers for Affordable Healthcare that have supported a number of bills at the legislature that would go beyond, your typical transparency bills, but actually trying to control hospital operations, hospital prices. And we have been very forthcoming to the legislature that we do not think those are the right policies for Indiana. Any type of price caps, any type of control of what a hospital can charge, because ultimately hospitals need to make decisions based on what works best for their community and not what the government would set. But as you can see, they're very active on Facebook. During one session, they had a van driving around the State House with different ads. And they do have a State House presence that we have to lobby against quite regularly. Another group in Indiana is called Employers Forum for Indiana. Again, similar group, pegged as trying to provide more affordable healthcare options for employers, but they've been singularly focused on hospitals and not really bringing much to the table with regard to actual solutions. I love hearing about, Good Samaritan's Direct Health that actually provides a solution to employers to help bring down their healthcare cost and have more curated care. But what we've seen from the Employers Forum of Indiana is more just advocacy related to those hospital bills that would, have a price cap or anything similar to that. Unfortunately for us, the leader of that group, Employers Forum of Indiana, now works for Governor Braun as his Secretary of Health and Human Services. So we interact with her frequently, but you can see there's definitely this continued drumbeat, continued hyper-focus on hospitals rather than kind of the broader healthcare ecosystem, which includes insurance companies, pharmaceuticals, medical device manufacturers, and the like. And kind of tying back to my opening slides, Arnold Ventures has invested in all of these groups, in the Employers Forum of Indiana and Hoosiers for Affordable Healthcare, in the RAND study that I mentioned that came out several years ago targeting hospital prices. They're investing in universities such as Berkeley to put out papers that continue to spread their narrative. The last available data we have on this is 2023. They've since switched how they're legally organized so that we can no longer see what organizations they're funding. But it was very clear to us, again, that this wasn't some consumer group, some kind of grassroots movement from Hoosiers. This attack on hospitals and hospital prices really came nationally and was funded to these groups. Again, not a general grassroots movement. We have been looking for other validators. There are plenty of studies out there that show that Indiana hospital prices are not above average, that our healthcare costs are pretty much in line with the national average. I have a few of those up here, showing we have actually some of the lowest annual family premiums across the country, but it still has required a lot of engagement with our legislators. We haven't been totally able to overcome that RAND narrative yet. So moving on from kind of the focus that we have received in the hospital industry to some of the bills that have actually been discussed. This was one of the big healthcare bills that was discussed during the 2025 legislative session and ultimately passed, House Bill 1004. It would have originally said a few different things. So for example, if you charged a facility fee at a hospital that is over 265% of Medicare, the hospital would have been charged an excise tax. So again, a bill was moving through the legislature that would have been a direct price cap on hospitals and saying what they could or could not charge, or otherwise be assessed an excise tax. These are some pretty radical policies for Indiana, and something that we had to be very honest about, that's just not the right direction of Indiana. Again, a hospital has to understand what it needs to charge on different services to be able to stay open for the community as a whole. And all of our Indiana hospitals are committed to affordability, but again, that one-size-fits-all is not the right solution for Indiana hospitals. Where the bill ended up is kind of at the top of the screen. The state is going to be studying what our average prices are here in Indiana, and then that average price is what our largest nonprofit hospital systems will not be able to charge above, or otherwise they will lose their state nonprofit status here in Indiana. That's still a very significant policy that passed. It does just apply to some of, like I said, some of our largest hospitals in the state, but it is still a very significant policy. Some other bills that were discussed this session, there was a bill moving that would have said basically anytime healthcare companies were thinking about merging, the state would have to approve it. And so anytime, say, a home healthcare company would want to acquire another healthcare company, or a dentist office merge, or a hospital acquire a physician group, the state would have to approve that. We did oppose that legislation, and where it ended up was more of a transparency bill, where different healthcare entities have to now disclose who owns and controls them, so that the legislature can have a better understanding of any healthcare consolidation in Indiana. But again, some pretty big discussions related to regulating healthcare in Indiana that are ongoing. And sorry, I'm just gonna check my time. Some bills that were discussed this session, but that did not advance, you can see up there. So for example, for the providing care to the employees on the state employee health plan, the state was trying to cap reimbursement for medical facilities at 200% of Medicare. That's much lower than that 265 we were talking about, and would have a significant impact on hospitals being able to provide care to those on the state employee health plan. We were able to ensure that did not move forward. Another bill would have required care to be provided to individuals at 200% of the federal poverty level or below at no cost, so essentially dictating free care given by hospitals to certain individuals. And I will say, the vast majority of hospitals in Indiana are already providing free or discounted care to this population. But again, the fact that such legislation is being discussed and considered in the legislature is what we find very concerning. Again, we want to make sure that our hospitals are able to make sure that they make decisions that are in the best interest of their community at large so that they can keep their doors open. So moving on from some of the state level policies that were considered this past session and ultimately enacted, I did want to share some about the federal reconciliation bill that passed this summer, what you would know as the One Big Beautiful Bill Act. So it contained a number of provisions, some very positive provisions related to long-term tax cuts and the like, but we were concerned with a few of the provisions that were included in the bill related to Medicaid. So like I said at the beginning, where I don't want to get too technical, but we as Indiana hospitals currently tax ourselves today, called the hospital assessment fee, provide the state that pool of funding. They send it to the federal government to leverage additional federal funds, and then that's what helps increase our Medicaid reimbursement today. So the hospital assessment fee program has been essential to hospitals to even getting that 57 cents on the dollar today. What the federal reconciliation bill did was say we want to slow the growth of these provider tax programs that Indiana and almost every other state across the country are using. And so we are going to phase down by 2032 how much providers like hospitals can tax themselves to leverage federal funds. That was a policy decision that was made, but it's going to have a significant impact here in Indiana. So we will actually have one of the 7th highest total dollar impacts across the nation when the OBBA goes fully into effect. And so like I was saying, we currently tax ourselves 6% on inpatient services and 4.5% on outpatient services. Both of those taxes will start to be phased down, and so we won't be able to leverage as many federal funds. And once that fully goes into effect in 2032, Indiana hospitals will receive about $1 billion less in Medicaid reimbursement than they do today. So $1 billion less in our hospital ecosystem come 2032, and it'll be phased in over time, but that will have definitely some reverberating effects. And if you ask me to put money on the table today, whether Indiana is going to backfill this as a state, I would say that they're not. We just don't have the budget for it currently. Our expenditures have been growing in other areas. So this, when it goes fully into effect, probably will have some very serious consequences related to whether hospitals change their current access for Medicaid patients or not. I'm not going to spend too much time on this because, again, it's getting technical, but we were seeking to maximize our hospital assessment fee, like I said, to bring additional dollars in the state to get us above that 57 cents on the dollar reimbursement. We just learned, and it would have been a very good program for Good Samaritan and the like, but we just learned that CMS will no longer be approving these types of programs unless they were grandfathered in. So we will not be likely pursuing any increases to our hospital assessment fee program as of today. just wanted to share some final kind of policy changes that are impacting Indiana hospitals and that they certainly want to keep their eye on. And again, I know this is a lot of information. It's more to share just everything that hospitals are having to consider and factor in as they make, their 2026 budgets and whether they might have to change policies in the future. So Governor Brown is certainly focused on hospitals and healthcare costs generally. And so earlier this year, we saw a number of executive orders issued that we will see the impacts in the coming months of whether it will result in any policy changes. So you can see there's a number there on the screen. He's having his agency review price transparency compliance. Here in Indiana, we are very compliant with the federal price transparency rules, but whether this results in his administration wanting to see some stronger regulations is still be determined. He has directed his agencies to compare each hospital's charity care with the value of tax exemptions received. Like I mentioned earlier, there is that focus on whether nonprofit hospitals are earning their tax exempt status. We believe they are more than earning their tax exempt status, but we'll be interested to see if his study comes out with any different results or recommendations related to that. I won't get too much into 340B and Governor Brown reviewing that program, but just know that 340B is a lifeline to many Indiana hospitals. It is where they are able to purchase discounted drugs from pharmaceutical manufacturers like Eli Lilly, and then use those savings that they receive at the hospital to provide different type of services to individuals and essentially backfill that gap where they don't get reimbursed adequately by the government. And there has been a lot of focus on 340B, both by Governor Brown as well as President Trump, you can see. We believe a lot of this is coming from the pharmaceutical manufacturers who do not want to continue providing discounted drugs to hospitals across the nation, and is not because of a true abuse by 340B hospitals, but there has been a lot of focus on this 340B program at the national and state level and trying to roll it back. And again, we believe that's fully from the pharmaceutical industry and not because there's a true need for reform. And then looking ahead, as you might have seen, there's been a lot of news lately about whether Indiana will meet for a special session this year, whether they'll just wait to convene in 2026. They met for Organization Day yesterday, and we do believe that they are not going to be redistricting at that time. I'm not going to give a redistricting talk. I'm here to talk about healthcare. But we do believe they'll come back probably January 5th of 2026. And have a short session, because then they will all want to get out by mid-March to start campaigning. All 100 state representatives are up this year for re-election, and half of our Senate is. So we think it will be a short session. But in the 2027 session, the long budget session, we do expect it to be a significant healthcare session, particularly around Medicaid. You have heard our concerns about Medicaid and the reimbursement dropping for hospitals, but the Medicaid expenditures of the state have been growing in a lot of other areas, and we expect them to try to get their hands around that. And a lot of that has been the Pathways program, which is primarily for long-term care services, and then just the general use of Medicaid by Hoosiers has continued to go up. They have been trying to control that enrollment, but we could see more controls on that by our legislature in the years to come. So I have shared a lot of information with you. As you can see, things are very complex at both the federal and state level right now. A lot of policies being discussed that could impact hospitals, that are impacting hospitals, and that could continue to do so. We have been, working with our state legislators, sharing our story. We launched a campaign earlier this year called My Hospital, My Lifeline, to talk about some of the positive work that our Indiana hospitals do across the state, because a lot of this, you start talking about 340B and legislators' eyes glaze over. So kind of sharing real stories has been kind of our new focus to ensure that legislators, when they are talking about these policies, understand that they impact real patients, real lives. So we kicked off that campaign and had a lot of different stories. I want to thank Good Samaritan for contributing to that campaign, and how the 340B program at your hospital helped Rob in the right-hand corner down there access life-saving treatment, because you were all able to use your 340B savings to help cover his care that he wouldn't have otherwise been able to receive. But a lot of this comes down to very complicated policy discussions that are impacting hospitals, but we try to put a face to that so that we can have the right conversation with our lawmakers, that ultimately what they're considering could impact folks like you see on the screen. I'm happy to answer any questions or go back to any slides, but didn't want to get too in the weeds, but just share kind of a high level of everything we're looking at right now.
I got a quick one for you, Laura. I think we got another mic over here. So you talk about a lot of different policies and different things like that. What can we do from a Chamber of Commerce standpoint, or even from local leaders, in advocating for strong, sustainable healthcare in Indiana? What can we do to help?
Yeah, absolutely. You know, we all know that healthcare needs to be more affordable, but we all know that our hospitals are doing the right thing, that they're good partners to our community. Anytime you are with one of your local elected officials, I would name them, but I won't do that to them. You know, you can share, you know, hey, I've heard that the Indiana State House has been really focused on hospitals. That doesn't seem to be a concern in our community. You know, just kind of, and sharing what the real concerns of your community are, because I think a lot of this is a national movement that's influencing them to focus on hospitals in a really unnecessary way. So I think sharing with them, your local elected officials, just kind of what you see in your community and what actually needs to be addressed is probably the best way you can support your healthcare ecosystem right now.
Any other questions? Anyone? Okay.
Keep it super short. Just what's the cliff notes? If 72% of our patients coming into the hospital are Medicare and Medicaid, and they are paying less than the cost of care, how does that even how does that work? You know, the government programs are supposed to be, you know, helping and subsidizing patients and giving them the ability to get care, good care. Why do they give them 50% of what they need to go to the hospital and get better?
It's chronic underpayment for many years, and they have tried to address that through these other supplemental payment programs. The government doesn't pay its fair share for Medicaid or Medicare. They don't. And they've tried to address it through other supplemental payment programs. Like I mentioned, the 340B in 1992, Congress was, you know, the idea of government underfunding Medicaid government programs is not new. And so they said, hey, pharmaceutical companies, you need to help us. You need to provide discounted drugs to hospitals to help fund what we're not funding for them. But now that program's under attack. And the honest answer to your question is, it results in a cost shift to employers and those with commercial insurance. Folks with commercial insurance are paying for what the government is not. And that's as truthful as I can be. Then we get attacked for having high commercial costs. We would say they're not any different than the national average. There's many studies that prove that. But they are too high. We would all agree with that. We wish the national average was lower. But until the government pays its fair share, or there's less folks on Medicare and Medicaid, commercial insurance will always make up that difference, unfortunately.
Any other questions? Okay.
Well, thank you so much. Thank you for bearing with me through a lot of complicated topics.
We appreciate your time. You know, that's the point of this, is bringing us information that we don't necessarily hear on a daily in here locally. So we appreciate you coming today and sharing your information. Before we move on, I think we missed, I want to reiterate what Adam said regarding to Rob, but Rob McClin, I don't know if you guys saw Facebook, he is the 2025 Distinguished Service Award winner from Indiana Hospital Association. So thank you and congratulations. You know, Rob, on behalf of the chamber, we want to extend our heartfelt thanks for all the years that you have given to our community. We're fortunate enough to have a strong regional hospital, and much of that is due to you and to the leadership and your vision and your commitment that you've given to our community. So thank you. Thank you for all of the years of service. We appreciate it. Thank you to Adam for speaking today. We appreciate the information. And thank you, Laura, for making the trek down from Indy to share your knowledge with us. We appreciate it. Thanks to our sponsors, Vincennes PBS, the Good Samaritan, Guardian Angel Home Health Care, Family Health Center, Good Samaritan Foundation, and Guardian Angel Personal Services. Thank you to all for your support. We really do appreciate that. With programs like this, the point of this is to bring this information to you that we, like we said earlier, that we don't necessarily hear on a daily basis. So thank you for sponsoring and making that happen. And thanks to everyone for having lunch with us today and sharing the afternoon. If you have further questions, I'm sure Adam and Laura will be able to answer those afterwards. But other than that, thank you so much and have a good afternoon.